Yep, that's me. Yeah, budding artist. They call me Smock Face. But, there's this really great saying from Picasso who said that, all children are born artists. And the problem is remaining an artist as we grow up. And actually, it might surprise you to think that being a cancer researcher is pretty similar. A budding scientist artist here. After all, kids are naturally very inquisitive. They just have this ability to pick out symmetry and patterns from the environment and innately ask really insightful questions, even in spite of not having all that many lived experiences. And what's really curious about kids is also just the way that they ask questions. They are so full of conviction and they care about everything except for how it makes them look or sound. In fact, this budding artist scientist, she has no concept of biting off more than she can chew. But probably, you weren't really expecting me to talk about cancer research in this way. Maybe you were more thinking I was going to talk about being a doctor in a white coat in a pristine lab at some prestigious university at a big hospital surrounded by textbooks. But it may actually astound you to learn that most of our nation's cancer care is actually delivered right in your community. A community being a clinic or an office right in your neighborhood. And the people who work there, who run the clinic, who lead the office, are healthcare workers who are a lot like you. We go to the same stores. We may have kids who go to the same schools. We're right in the thick of it with you. In fact, according to the National Institute of Health, about 80 to 85% of the nation's cancer care is delivered in the community setting. And so it naturally follows that cancer research, as much as 80% of the nation's cancer research, is happening right in your community, all around you. Even as we speak right now, there's cancer research that happens right here in this town. And in a lot of ways, that makes a lot of sense because, we really want that technological advancement at big academic centers. They have all those resources. They have the highly intelligent and well-trained people who can do the highly rigorous, meticulous science. They can do the controlled, randomized trials. But we also need providers who can take all of that, all of those skills, knowledge, and they can apply it to the real world, to the day-to-day that we all live together. Those providers who understand those non-medical, multidimensional factors of our health and wellness. Things like, how do you even get transportation to go to your doctor appointment? Who's going to help drive you if you're not feeling so good? Or like food, diet. Now I got to eat really healthy. Where are you going to go to get all of that healthy, nutritious food? Or employment, like your careers, your livelihood. Like, how do we help you preserve that when you're feeling sick and the future's so uncertain? In a lot of ways, your community providers, They are like a barometer for understanding cancer as a field, as it evolves, as it shifts beneath our feet. And one very specific trend that a lot of us are noticing in the community, and really all over the world for decades, is this concerning, somewhat mysterious trend of increasing incidences of cancer in young adults. And each year seeing more young people get cancer and dying from cancer. And this is without clear reason because, traditionally we think of cancer as an aging illness, as something that we accumulated some insults over time, seemingly from some predictable, possibly avoidable risk factors. Or we think of cancer as being inborn. It was an error in the pediatric world, like pediatric leukemia. But we don't really think about it like someone who is young and thriving, and they're starting a family, and they have a career, and they're trying to get home, and then they get cancer, and then they die. When something like that happens, in general, it's mind-blowing. And when it happens in a community, and a community provider witnesses this, it's particularly impactful. I am a cancer doctor. I am a cancer researcher. But I've also been touched by cancer before I became a professional. When I was in college, I had a friend and classmate who died of colon cancer. And that experience taught me a very important lesson that I want to share with all of you today. When he died, I felt helplessness. But there's something really astounding about the human spirit, that when your circumstances introduce so much hurt, it really calls you forth to fill in that space. And in my grieving process, I experienced the epiphany that helplessness is not a fact. Helplessness was a choice, and I was not going to make that choice anymore. I went to medical school, and I observed my medical education as a reflection of really our education system at large everywhere. And same thing with our cancer research. It seems that we have this hierarchy, that at the top we have the highly esteemed sciences and mathematics and linguistics, and then somewhere in the middle we have humanities, and then at the very bottom we kind of forget about art and co-creative expression. But I questioned this because I've always thought that the human intellect is more dynamic than really any structure can capture, and even more all-encompassing than human intellect is human consciousness. And that is to say, when I was doing my cancer research and I was putting myself out there and I was speaking my ideas and I was publishing, it occurred to me, it was like this miraculous realization that there might be like one person or maybe 10 people or 100 people out there. I've never met them before, and probably most of them I'm never actually going to ever meet, ever. But they were connecting with my work. They were relating to me. And then in their own right going off and creating something beyond imagination. And I was understanding that my cancer research was community. And this is the lesson that I want to share with you, that, for me, the opposite of helplessness is choosing community care. There was some time where I thought that I was going to have to be picking up my pieces. But after I chose community care, I realized that my pieces already knew what to do on their own. I finished my cancer research and training, took all of those skills, took all of that experience, the ideas, the vision for the future, and everything, the collaboration, the network. I decided I wanted to go to the community. I wanted to leave academia. And I came here. I've been here with all of you. And I am so excited. I am so excited for all of the collaborations and all the creativity that we can experience together for a better future that is beyond what any of us can imagine on our own. For me, community means so many things. It means abundant action. Just make that leap of faith. Yeah, it's really scary. Yeah, it makes your stomach feel kind of queasy. But you just do it anyway and just pack extra underwear. Or for me, community also means just pure service, feeling like you're part of a team and you want to take care of that team because when you do a really good job, they're going to take care of you. And community also means to me remembering the people that you miss and that you didn't actually lose them. That, you get to keep that relationship and they keep you. I don't believe that relationships can ever be destroyed. I think about the child artist scientist who just really cares. That child that just really cares. And I think all of us, like Picasso said, we're all child artists and scientists. And you know that you care because we've all been there. We've all had that painful experience. But that's how you know that you care, because you still do it even though you knew it was going to hurt. And I can say, from being here for the past 5 years, I can say I've witnessed it myself, that really, nothing can beat a community. Really, nothing can beat a community that just really cares. Nothing can beat a community that just really cares. So, thank you.